Hello, everyone. My name is Jennifer. I'm the CHD Director for Conquering CHD, and I'm here with Megan, a young adult with CHD. Today, Megan is going to talk to us about CHD and mental health. Hi, Megan. Thanks for joining us.
Hi, Jennifer. Thank you so much for having me. I was so incredibly excited when you had asked me to speak about, especially mental health. It's such an important topic that people don't talk enough about, in my opinion, especially with CHD. And so thank you so much for having me and talking about such an important topic, especially for us patients.
Absolutely. Before we get into the mental health questions, why don't you tell us a little bit about yourself?
So my name is Meg Didier. I am 29. I was born with hypoplastic left heart syndrome in 1991. So I guess I'm considered one of like the first crew of us HLHSers. And I went through the 4 open heart surgeries and, of course, multiple procedures, multiple tests. I mean, we all know the drill. And I started trying to get involved with the community. I felt like, honestly, for my own mental health, I did not have growing up. I didn't know anyone with my heart condition, let alone really actually like, I didn't even know anyone with CHD. And I just felt completely alone, completely isolated. And like, I didn't have anyone that I could really relate to. And so I decided that I wanted to try to get involved with the community to make friends, essentially. I wanted to try to meet people and try to like not feel as alone. And I think that was really impactful with almost how difficult that was for me to figure out and meet people. And that kind of really drove me to get involved with the community. I am currently involved with the Fontan Outcomes Network, which is a lifespan registry for Fontan patients that is just recently launching. It's really, really exciting. I co-lead the Building Community and Engagement team. And I also co-founded the Single Ventricle Patient Day, which was really derived from wanting to build a community and wanting to build a community of patient leaders and give us patients the tools and resources and be able to talk directly to the providers to be able to kind of really use the patient voice and kind of put their money where their mouth is. They say they want patient engagement. And so we're here, we're ready. And that was kind of the other drive behind this. And I got involved in the community. I now live in California. Right now, I'm actually in the wilderness, backpacking in California right now. I'm trying to just live life as much as possible. I have my yearly appointment coming up the next few weeks, which I think everyone can kind of relate to is really anxiety inducing, I guess you could say. And so kind of trying to cope with that right now. And I'm just so grateful to be here.
Great. Well, thanks again for joining us. It sounds like you're doing some incredible work, and we really appreciate you taking time out of your day to answer some questions and continue to help the community. I'll just jump right in then. The first question that I had for you was, I wanted to know if you could tell us a little bit about what it's like to live with CHD, how it has impacted your mental health.
I think about this a lot because I don't really think I understood growing up how much my mental health was impacted. And I think a lot of that came from a lack of discussion. There wasn't a discussion at appointments. No one was really there was still especially such a strong stigma at that point in the early mid. I mean, there still is to this day a stigma for mental health. And I think that growing up, people, my providers, my team was so concerned with making sure that my heart was okay that I felt like there were some things such as mental health that were just not thought of as important. And so I just thought that the feelings and thoughts and experiences that I had were just normal. And I was just kind of being dramatic or kind of overthinking everything. And so my mental health has impacted me so much. And I think I'm really starting to understand to the level that it has, especially, getting older, kind of, especially retrospectively looking back on my childhood and thinking to myself, wow, there was a lot of things. I feel like a lot of my life, my decisions are made by concerns over mortality and concerns over how long do I have to live? What is my quality of life going to be? How much longer do I have where I can do things like I do right now? And I think that drives a lot of the decisions that I make in my life. And on top of that, I, of course, have PTSD and just overall anxiety and depression. And I think about my heart on a daily basis. And so I think in ways the constant reminder of it is impactful on a daily basis. And I think the anxiety and depression has really, really driven a lot of decisions that I have made over the course of my life.
Yeah, I think that's something a lot of us can relate to. Did you have trouble figuring out what was going on with the anxiety and depression, or were you able to get a diagnosis early on, or what was that process like of getting a diagnosis?
So kind of like I was just saying, that it wasn't a discussion. It was never really a discussion. And the only time I really went to the doctors were for cardio visits. I would go and just have my yearly workup, or, I'd go in to the ER for some heart issue. And that was like considered my time at the doctors. And no one ever brought that up. And so it just was never a discussion. I was definitely not diagnosed until I was in college and started thinking to myself, wait, my other friends like aren't really feeling these sort of things. Like maybe this is something I should be looking at. But I think I had a difficult time caring enough about my mental health at that point to really bring myself to go and get that diagnosis, to go and try to figure out what I can do to improve it, because I was in such a state of struggling with my mental health so much that I don't think I realized it. And I think if there had been discussions saying that this is something that we could anticipate with especially your heart defect, that there's going to be times you feel anxious, that would have been a game changer in my life if those discussions happened earlier, and they didn't. And so now I feel like I kind of have to take a few steps back to even try to like untangle the coping mechanisms that I created without realizing that they weren't healthy.
Yeah, absolutely. You've mentioned a few mental health terms already, but there's a lot of them that are seemingly interchangeable, like either anxiety or depression or PTSD. Could you maybe tell us a little bit what the difference is between those different diagnoses?
So for me personally, I think anxiety and depression were actually the three that I have been diagnosed with, I think I had a hard time kind of understanding, because I was like, I'm not depressed, I'm just anxious. And they're like, no, no, you're clinically depressed. And so I was like, wait, what is the difference between that? And so I think for me, at least, it's manifested itself in ways. So I think that I have a hard time distinguishing between my anxiety and depression sometimes. And I think that, especially with COVID recently, I think I have seen my depression come out in ways that I haven't before, to where I'm better understanding myself and like when I'm anxious or when it's depression. And PTSD for me comes in, it's like an immediate, I literally can't control like my breathing, and I'm starting to hyperventilate and immediate stress. And so that's like a trigger. Sometimes I'm aware that's happening, or sometimes I'm like, where is this even coming from? Yeah. And so a lot of that I associate with PTSD. And my depression, I think I associate having a hard time getting up out of bed some mornings, having a hard time falling asleep because I am scared of dying, having days where I think my depression will manifest itself in anger, as well as anxiety too, in being upset and wishing that, sometimes I do wish like I had a full heart. I think like all of us have kind of been there before, where we're like, man, what would have happened if I did? Like, what would have changed in my life? And so sometimes I think I still have a hard time differentiating between my depression and anxiety, but they manifest themselves in similar ways, especially with that.
Yeah. You mentioned earlier that there's still sort of a stigma on mental health and talking about it. What are some of the things you think that we can do to combat that stigma?
I think one of the things that we can immediately do is start talking about it. I mean, this is something that we need to be, not we, the providers, the teams, the medical professionals need to be discussing this. They need to be bringing it up immediately, talking to parents, because through this journey, it's not just patients that have mental health, have their mental health suffer. I mean, parents as well have PTSD. Parents as well. I mean, it's traumatic for every person involved. And so I think for everyone's sake, especially if you're helping the parents in the beginning and saying, this is what we're going to expect for it. There's a dynamic shift. There's a family dynamic shift. There is trauma that's associated with this, and you should go and talk to someone about it, because that's okay to have someone to just lean on. And I think if we really started there, that might be able to help kind of lead the transition for patients to be able to, immediately, okay, we're just going to start therapy right off the bat. Everyone's kind of trying to have a healthier mindset. Plus they have a good outlet, like a healthy outlet in a therapist, because sometimes all you really need is just to be able to talk it out.
Yeah.
And I think having those discussions would hugely impact the stigma, especially for us, because having it never mentioned at appointments makes us, I guess for me personally, feel abnormal. Like if everyone is feeling this for the most part, why isn't this just a typical conversation?
Right.
So that's what I think would be the biggest thing.
Yeah, absolutely. You don't want to feel embarrassed bringing it up either, because you think you're the weird one. So you don't want to
Absolutely.
ask and point it out,
Absolutely. And I think that, we go to these appointments and there's formality questions that we have. And those formality questions don't really hit the conversation the way that it could, because I think a lot of us get in the habit of saying, no, good, and no, like you just yes, no, instead of actually having a full discussion about it. And so I think going beyond the formality questions for mental health is what we should be doing.
Yeah. You talked a little bit about how your life is impacted on a day-to-day basis from because of your mental health, but can you kind of run us through a typical day and how your day might be impacted by how your emotions are hitting you that day?
Absolutely. And I think I pretty much know right off the bat in the morning if it's going to be a rough day or not. And I probably have a good 50-50 mixture of like hard days and good days. And that's something that I'm actively trying to work on. A lot of times sleep plays a huge role for me because I have insomnia, and a lot of that derives from anxiety and truthfully sometimes being afraid to fall asleep because you don't know, like you just don't know. Sometimes it's scary. And I think that right off the bat, so going to sleep, not sleeping, that already just is not a good start to the day. usually I know if I didn't sleep the night before, we're going to have a rough day.
Yeah.
But I have tried really hard. Like right now I am backpacking in the wilderness with actually 2 nurses, which is very convenient for me, 2 ICU nurses. And so I tend to kind of do that a lot of times with try to be with nurses, but I come out and do these hikes, and I try to stay as active as possible. Because for me, having those endorphins and being able to exercise and kind of get myself moving, I feel better overall, like physically and mentally. It also makes me feel better as well. I think I've recognized a lot of my triggers being sometimes even social media. So sometimes you see that some posts and that'll trigger you, and it's no one's fault. It's not anything wrong with that, but I think everyone's kind of experienced that on social media, where it just kind of brings you back to a moment or brings you back to a situation. And so sometimes that can definitely impact me. So there are days that I kind of stay away from social media maybe. And palpitations, when I have heart palpitations, I'm having a lot of heart palpitations that day. That's really triggering for me and my PTSD and anxiety, because I've gone into AFib and I just replay the situation over in my mind. And it's just so easy for me to put myself in the situation of being in the trauma bay for something, whether it be my stroke or I don't feel good overall or being an AFib. And I think that's the hardest thing mental health wise, is because if I don't try to ground myself or don't try to keep myself, I don't want to call it distracted, but when you're doing things active, like if like hiking right now is keeping my mind off of a lot of the things, because I'm just trying to, focus on the present moment. And a lot of times I just bring myself back to the moments of being in the hospital. And that's one of the hardest things for me to try to keep moving forward when I start having those feelings. And a lot of that is just recognizing it, that this is what's happening. I know that this is what's triggering me right now. What can I do to ground myself to be able to pull myself out of this right now? And I think I've worked really hard on trying to do that. And it's been really, really, really hard, because I tend to get overwhelmed really quickly if I'm frustrated or if I'm anxious or anything like that. And so recognizing I need to ground myself before it gets out of control has been something that's really helped me.
Okay. Are there certain activities that you do? I know you mentioned hiking through the woods.
Yeah.
Are there other tricks that you have to kind of calm yourself back down and to bring you back to the present?
Yeah, I think deep breathing is something that I didn't recognize how powerful it was until I actually went to AFib and they were just telling me, just breathe. I'm like, how is this going to do anything? And it just kind of recognizing, okay, you can really do, like, you can control your heart rate in ways. Obviously, if you're like in an arrhythmia, that's not necessarily what I mean, but keeping yourself more like calm and, you know, breathing like in a rhythm, I guess you could say, like deep breathing has helped me tremendously. Hiking, skiing, being involved. There's weekly CHD calls that I go on that is really nice to be able to talk to people. And that's another thing, like being involved in the community, whether you're on those CHD calls, whether you're in those Facebook groups, having those people that you can relate to is so massive in, you know, kind of helping ground yourself, because you're like, okay, we're all going to kind of help ourselves in this situation. We're all okay. It's okay. And then with things like being nervous of my stroke or going into AFib, there are things that I do. Like I remember when I had my stroke, I was in public and it was incredibly traumatizing. I lost the ability to talk, and it took me a very long time. And still to this day, I'll have moments where I'm like, am I having another stroke right now? And I'm like, okay, you're fine. And so I have like little tests for myself. I'll be like, is my face drooping? Can I smile? Like I go through like the entire fast, like trying to make sure, like, okay, let's see. And so I try to come up with things like that, like, or if I'm getting nervous, I look at my gums color or my fingernail color. And I try to do things that I know if things were actually really going downhill, there would be signs in the things that I'm looking at. That's kind of what I try to do to help cope.
How do you help ensure that your anxiety and depression doesn't impact your physical health?
I think that it has. And I think that I am trying really hard to make sure that doesn't happen. And I think COVID really backslid me a bit, because when you are kind of isolated and you have to, there's just so much stress going on and there's so much change going on. I really was nervous to leave, especially in the beginning, and I was nervous to be around people. And so a lot of times I just kind of like kept myself inside. And so I have been really trying to just go on walks, like even if it's just a very, very, very quick walk or something like that. That's, I guess, kind of another thing that has been helping me.
Great. The last thing I just wanted to ask was, what advice would you give those who may be struggling like you have with mental health issues?
Never stop pushing your team, your healthcare team. If they haven't given you resources, ask. Because I think for me, I was afraid to ask or afraid to bring it up because of stigma and because it was never brought up. And so if you aren't getting the answers and you truly feel like, you know, there's something that could be improved with myself, and that's completely normal. And I hope that everyone knows it is completely normal. And it is okay to take time to make sure that you are okay and that your mental health is okay, because I make excuses all the time for myself. Like I have too much work to do. I have too many things to do, and I can't do that. I need to prioritize my mental health. So prioritizing and making sure that you're advocating for yourself to get the resources you need, and just never stop pushing and try to really be consistent. Find what makes you happy. Find out what makes you get excited to get out of bed. Find out what makes you just kind of forget about the world around you. Like for me, that's skiing. And try to stick to those things when you're having a hard day, because those things would be the things that make you smile and that make you kind of come out of your shell a little bit when you're having a rough day. And just know you're not alone. There's a whole community of us who feel exactly the same way in so many ways. And that's another reason we made the Single Ventricle Patient Day, because that's an event that all of us can come together and get those resources that we, especially us older ones who never really had those resources. I know they're really trying on pushing more resources. There's never going to be enough for us, but we want that to always be a place for people to come and know that they can get the resources that they need, whether it be for mental health, whether it be for any other part of their health, or quality of life. And so just never stop pushing and advocating for yourself.
Awesome. That's great advice. One last thing I did mean to ask you as well. What would you tell somebody, maybe outsiders who don't know what it's like to struggle with mental health? What would you want them to know?
I think I would want them to know to always be patient. Just be patient, because every single person has a story. You never know what's going on in someone's life, and just always be patient and kind. And with CHD specifically, although we may look healthy on the outside, right? Like this invisible illness, there's a lot that's going on. And that kind of goes with everyone has a story. And sometimes I find it difficult to have people almost believe me that there's a lot of things that I struggle with my heart, especially with mental health. And so I just be patient and always know that someone has a story, and always try to be kind.
Awesome. Thanks again for joining us tonight and being so candid with sharing your story. I really appreciate it.
Absolutely. Thank you so much for having me. I really, really am so glad to be here.
All right. Thanks everyone for watching, and we hope you have a good night.
Thank you.